My name is Jim Kinderknecht, and I'm one of the physicians at Hospital for Special Surgery. I'm in primary care sports medicine, so it's the non-operative sports medicine. There's three pieces to the puzzle to make the diagnosis typically in most things that I see. One of those being the symptoms, and so getting a great sense of what people's symptoms are, their mechanism of injury, if there is an injury. Then couple that with what I'm finding on their exam, and then the last piece of the puzzle is using imaging. The first goal is to get control of the pain, but the problem is if patients interpret that as an endpoint and they go back when the pain's gone, most of the time they're set up for re-injury. So it's a matter of, I always say, restoring their strength, restoring their flexibility is what allows them to return and return without re-injury. A lot of times the answer isn't don't exercise, it's really adjusting it. So it's not rest, but it's relative rest. And so it's kind of picking and choosing, figuring out what's going to work for the condition that's present, rehabilitating that, treating it, protecting it in some senses, and then progressing them back to doing the activity they want to do. When a 70-year-old with arthritic knees comes into me and our treatment allows them to be more active and more functional, that's as good of the feeling as I get when, you know, a professional athlete is back on the playing field after getting injured. The thing that makes the Hospital for Special Surgery unique is the expertise, and so in the expertise in a very wide range. It's a center of excellence, and we're all driven to maintain that or achieve that or combination of that because we know how good our peers are. So it really is everybody raising the bar.